Yes, I think what happened today was that we were met with some of the members of our leadership that are overseeing a lot of the information technology, those kinds of things. They basically met us. They escorted us out. We were able to drive away. It was not a tremendous, significant problem, but it's really the accumulation of a lot that has been happening over the last several weeks, where we were getting requests for data. We were trying to get that data available for the administration to look at, but we just have no idea exactly what they are planning to do with it. We need to get politics out of public health. And I think the secretary right now could do a lot to open up, have more transparency, and help us understand what it is that they're trying to do with the data and what they're trying to revise with a lot of the vaccine recommendations.
Dr. Jernigan, last December, I had a conversation with a fellow CDC official. And the conversation I remember very clearly, because the question that I had during that transition ahead of Inauguration Day was, if this administration tried to politicize the CDC, what would then happen? And this official told me very clearly that there was a scientific integrity clearance process, effectively. You had scientists, you had statisticians in there to ensure that anything that ultimately got to the American public was true peer-reviewed science. After your departure and that of your other CDC colleagues, what should the American public expect about the scientific integrity that was released to them in these coming weeks?
Well, I can't speak to exactly what is going to come out. I have not seen it. I do know that we have talked with the administration. We have gotten indications that what is being done is legal. But I cannot see that the scientific practice that they're using is one that is best standard, gold standard science. And I can't tell whether or not the ethical responsibility of the personally identifiable information, things like that, that are in the data, I can't speak to that. And so the American public we need to see what that data shows, and then we need to make some assessments of whether or not we can trust that information.
Dr. Patel, America has a health care crisis. And at the center of that crisis is Donald Trump and RFK Jr. I'd like you to listen to Trump and RFK during the 2024 cycle talking about making America healthy again. Let's take a listen.
I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines.
I'm not going to take away anybody's vaccines. I've never been anti-vaccine.
You will not take any vaccine that is currently on the market.
I'm not. If vaccines are working for somebody, I'm not going to take them away.
Well, that was a load of crap, because just this week, his health department said that, oh, guess what? Those of you who get COVID, too bad, because if you're not 65 or if you're not a baby, you don't get it anymore.
Right.
So the reality of it is we're at the center of what will be an emerging as we go into the winter and we go into flu season and people start getting sick. There's going to be a whole lot of pressure on this administration when it comes to health. Talk us through a little bit of that. And what's your sense of what you're seeing happening at CDC from your experience working on the policy side with the Obama administration, certainly even going back to the Bush administration? You've got both the government and the practical, everyday medical, understanding of how this all comes together.
Yeah, so the practical, Michael, is very clear. People are confused, including health practitioners. So just today, I had a patient who went to CVS to try to get just whatever vaccine was available. And they said, well, you need a prescription. And she said, why do I need a prescription? And there was actually just erroneous guidance given because they were reacting to, unfortunately, like the words that you just heard, the recent words we heard from the secretary. So what people don't realize is that's not guidance. The CDC actually hasn't changed their guidance, and that's part of the reason that they asked Dr. Menarez to resign, was that she had basically said, I'm not rubber stamping something without going through the process that Dan described.
The science.
Right, exactly. So you've got public that are confused, you've got health professionals who are confused, and not to mention access, because insurance companies hopefully will not follow whatever RFK Jr. is saying. They really do need to follow what comes ultimately out of the CDC, but now we know that with, as you mentioned, with an interim director who may or may not be the person that will just react politically, that puts the science of vaccines in peril. And what America does, the world follows. It's not an accident that the WHO and many of the global health community follow what the CDC recommends.
Mm-hmm. I am just very struck by these stories that are coming out. And then what I heard from Dr. Jernigan, to say that they were asking for all this data and they don't, the scientists were skeptical and concerned about what they were asking for, they as in the administration, and what it would be used for. I mean, is it hyperbole to say that we're in trouble?
Yeah, I think right now we are in a situation where we don't actually understand what it is that they're trying to do with that data. We don't know the processes that they're going to be using to do the analyses. And so with that, it does call into question what findings may be presented in the next few weeks that may undermine a lot of the scientific studies that have been done in the past.
I will just say, y'all, I remember when I worked at the White House, obviously during COVID 2021, and it was not the policy people who were making the decisions about what is it that we're saying to the American people. The CDC director was in the room. Dr. Fauci was in the room. NIH, we had doctors, and there was oftentimes disputes amongst the scientists and the doctor folk and the political people about what we wanted to do. Mm-hmm. But at the end of the day, we led with the science, and the times that we did not, like when they suggested that everybody get mailed a COVID test and the political people in the room said it was too expensive, people were literally standing in lines all across this country clamoring for COVID tests. And only after that did we mail these COVID tests. So I say that to say I am disturbed by what I am hearing.
And this is a real issue moving forward. Another pandemic could come. I mean, we're talking about children immunizations. The beginning of this school year is starting right now across the country. And one of the parts off of what you're saying, Simone, was I almost kind of regret my question in a way to Secretary Kennedy during the transition before he took on this role, because the reason I was asking, can you promise you're not going to remove any vaccines from the market? It's because his nonprofit tried to petition the FDA to remove the COVID vaccine from being available to the public. But clearly what is being suggested over the CDC right now is potential changes to the immunization schedule. Right. Can you be very specific for the public? You know, OK, they may not remove a vaccine or make it not available to the public, right, but what is the impact of changing the immunization schedule?
It's a huge impact, and it started in June when the Secretary replaced the entire Advisory Commission on Immunization Practices, or ACIP, which is the advisory body that makes these recommendations based on data, which is, to Dan's point, who knows what kind of data they're going to get. We have to see. Then they make a recommendation to the CDC director. Historically, the CDC director follows those recommendations, but we know that that commission has been replaced with people who have been vocal and current vaccine skeptics, and that changes an immunization schedule that has implications for what we do in the clinic and setting and what it can get covered with insurance. And it has implications, as you pointed out, not just during the height of a respiratory season, but this is ongoing immunity that we have to protect us over our lives. It's not just when we're babies. Tetanus shot every 10 years, flu shots, pneumonia shot when you're 65, RSV. These are all kind of part of the immunization schedule. We as an American public have taken it for granted, Vaughn, because it's always worked. We've never had to, as Simone said, doubt the science. And now it's not working. And I can't believe I'm going to say this. I don't go to the CDC.gov website to get my recommendations. I'm going to AAP.org. I'm going to AAFP.org. I'm going to the medical societies who have taken a courageous and risky stance to say, this is what the science shows us, and we disagree with where HHS has landed.
Dan, Deborah Hari was the CDC's chief medical officer before she resigned. She had this to say today on MSNBC Reports. Let's take a quick listen to her words of warning.
CDC is in trouble. Public health is in trouble. We need people to pay attention. I am very concerned other leaders are going to leave, and we already don't have enough staffing with a lot of the reductions in force and terminations that recently happened. So we're not going to be prepared for another outbreak should it happen. We can't prevent chronic diseases in communities because we don't have the resources anymore.
After I gave you the wrong thing.
Doctor, the warning can't be any more clear. I mean, you know, what you hear Dr. Patel saying just now about where she's going, where, you know, what the medical community, how it's responding. Citizens are now at the mercy of a rogue, highly incompetent group of individuals who don't, at the end of the day, in my estimation, have the health care of the American people in mind. To Vaughn's point, you've got young kids who are going to be going to school this fall, it already started, and we've already seen pockets of measles exploding around the country. You think that's not going to get worse? Of course it is. And yet, we don't have the vaccines to protect the kids. What the hell are we doing as a country now when we have dumbed down medical care to the point where the idiocracy is telling smart scientists they don't know what they're doing?
Yeah, I can't speak to all of that, but I can say that,
Speak to enough of it. We're good.
It is a global, preeminent public health agency. And I have been here for 30 years. I've worked with multiple different administrations. I was willing to work with this administration, but I find that the transparency is not there, and the possibility that the information that comes out from the secretary over the next several weeks will be something that I will not be able to support. And that the American public will have to call into question. And so that's a place I've never been before. I don't like being in that place, but I do want everyone to know that, American people to know that CDC should be the place where you get your information, where you find out how to protect yourself, to get the recommendations. And if we're not able to do that, we'll have to find some other way.